Sickle cell disease is a genetic blood disorder caused by the presence of an abnormal form of hemoglobin. These hemoglobin molecules tend to aggregate after unloading oxygen, forming long, rod-like structures that force the red cells to assume a sickle shape. Unlike normal red cells, which are usually smooth and malleable, the sickle red cells cannot squeeze through small blood vessels. When the sickle cells block small blood vessels, the organs are deprived of blood and oxygen. This leads to periodic episodes of pain and damages to the vital organs.
What is your understanding of sickle cell anemia?
It's disease passed down from both parents where your red blood cells have a crescent or sickle shape instead of being rounded and disc-like. They can't carry as much oxygen. If you inherit it from only one parent, then you carry the trait, but if you don't have it, it inhibits oxygen delivery to parts of your body, especially the extremities. And it can cause blood clots and things like that, which would cause you to have a stroke or a heart attack or something.
What's your understanding of sickle cell anemia?
Sickle cell anemia is a genetic disorder that's primarily associated with darker skinned people. And then where the cells, the blood cells are almost cup-shaped, saucer-shaped, and they tend to jam together, causing physiological problems. And that's about the extent of my knowledge of it.
What is your understanding of sickle cell anemia?
It's like developed. Most people find it when kids are about 4 months old. About more of the African American population has it than anybody else. It has to do with the red blood cells that form like a crescent type shape, and it's very common.
It all depends. The only way to find out if you're at risk is to get tested. A person that has sickle cell anemia will have 2 abnormal genes. A person that only has 1 abnormal gene and 1 normal gene will typically be referred to as having the sickle cell trait.
Well, I don't know anybody that has it, so I really don't know enough about it to be able to tell me if I feel like I'm at risk or not.
It's a disease. Anyone can get a disease. No one's immune to a disease. It's a disease. Because of the fact that I don't think disease is ever classified. A child can get the same disease as an adult can. Men can get breast cancer. The word disease implies
No, I don't feel like I'm at risk for sickle cell disease because during my time in basic training, that was one of the medical clearances that we had to go through, and the demographic happened to be African American, and so with myself being Caucasian, I don't feel the risk at all.
If you have sickle cell trait, you have inherited the gene for sickle cell disease. Medical problems caused by sickle cell include blood clots, stroke, the blockage of blood flow, which is caused by the sickled cells, and that causes damage to most organs including the lungs, spleen, kidneys, and liver. Sickle cell is a global health problem in the United States. It is estimated that over 70,000 people have sickle cell disease. About 1,000 babies are born with the disease each year in the U.S. alone. So what is the average life expectancy, you might ask? The average life expectancy in the United States has actually gone up to about 40 years of age. Are people of African American descent the only ones affected by sickle cell? No, it is also present in Portuguese, Spanish, French Corsicans, Sardinians, Sicilians, mainland Italians, Greeks, Turks, and Cypriots, also in Middle Eastern countries and Asia. Hey Morgan, is sickle cell curable or treatable?
It's curable?
Hey Rachel, is sickle cell curable?
Not that I'm aware of.
I don't believe it is. I believe it's treatable, and that's all I know.
There is no universal cure for sickle cell disease. Research in gene therapy, the ultimate universal cure, is currently underway. For now, it is just treatable. The use of hydroxyurea has shown promising results on some adult patients. It reduces the frequency of severe chest pain, acute chest syndrome, and the need for blood transfusions.
How can you share it, you ask? We encourage you to post it on your Facebook page or your Twitter account, or email it to all the contacts on your list.
For more information and how you can help, please visit www.sicklecellministries.org.